Welcome, everyone, on this beautiful summer day. Today is June 24th, and we're very excited to have with us Joyce Day. I really do consider her an expert. She has taught probably her third or fourth class. Joyce Ann, correct me if I'm wrong, has done an outstanding job. I get requests each time to have her back. Fascia and the missing piece of the pain puzzle. So definitely send that to folks. And here are some June specials. This is going to run through the 30th with a 200 PV order. And yes, you can still get your frankincense if you place a foundational wellness bundle, even on the 30th up until midnight Mountain Time. And our oils came in our endless summer, guys. The spray is much better than I ever anticipated, so it's fantastic. I would highly recommend that you get those, and these are a limit of 4. You'll see these limited time offers. And then Kayla put this together, so you'll see all of the promotions that are still out there. And really, there isn't anything on here that's not outstanding. So definitely get your orders in before the end of the month. Maybe you want to add something to them so that you can get your rose as well. Take a picture of this. Great. I tried Dale's Shinrin Yuku, guys, the bath bar. Oh, it's amazing. So next week, Dr. Lori Langfit, dehydrated or demineralized. So that will be a great class as well. And then if you're local, next Thursday, July 2nd, Dr. Lynn is on. Dr. Lynn is going to be at our house, and we're going to be and do an unplugged. Again, bring some friends. And again, we do not allow phones or anything or any recording of any sort. On the 8th, Dr. Tina Wong, a pediatrician and presidential diamond, enhancing intimacy with essential oils. And Lauren Bush. I am not sure if she's got 8 kids or somewhere thereabouts. And hers is Mom Life Must-Haves. I'm really excited to listen to that. And then, of course, who does not want to hear and learn more about parasites? The parasite conversation we need to have with Dr. Shane. And a daily energy routine with essential oils. And we have with us Angela on the 29th. And this is a Master's Club class, which means that if you enroll anyone from tonight's class, and or you just need, you're going to be enrolling someone. This one here, what's vision that's up here right now, is going to be through June 30th, and then the rose will go off. But the rest of the goodies will be, and I understand that this is going off on June 30th as well, placing the 200 PV order and getting 20% off. So there we go. So without further ado, I'm going to stop sharing. And I am so excited to turn this over to Joyce and Day.
Well, hello everyone. I am so excited. So, Sandy, you'll pin me, right?
I'm doing that right now.
Okay. And then I'm going to share my presentation. All right. And I'm not going to look at the chat while I'm talking because I'll get distracted and I don't want to get distracted. So I
And
will.
that's okay, Joyce Ann, because we're not going to answer anything till after we stop the recording anyway. So you're good to go.
I love it. All right. That sounds great. Well, welcome everybody. It's so good to be back. I love coming on these calls with you guys. It's so fun. It also feels like a reunion because I get to see all your familiar faces too, so that's good. Well, I'm Joyce, and I am a diamond in doTERRA and also a licensed massage therapist in Illinois. I have been working in with fascia for about 6 years now, and it started for me in with a broken leg, a severely broken leg about 7 years ago, 6 years ago. And I was cross country skiing, and I'm a good skier. It was just a random fluke accident. And everything, there was ice, and I went down a really steep hill, and I tried to, manage the hill, and I just got caught in the ice. My ski got stuck in a frozen ski rut, and I spiral fractured my leg. So you can see here from the picture, it was pretty brutal. I also broke my fibula, if you can see it down there in the very bottom corner, that second bone in your lower leg. And to fix it, they drove a steel rod around 16 inches long through my thigh, under my kneecap, down inside the bone with a hammer. Okay. And then they put a bunch of screws in place to hold it there. So after a year of physical therapy, about 14 months of physical therapy, chiropractic, massage, I mean, you name it, all the things. I did everything they asked me to do and more. I was walking every day, all of it. I still couldn't barely bend my knee, and I couldn't sit cross-legged. I couldn't get up and down from the floor. My daughter was young. I was only 41 years old, and my doctors told me there was nothing else I could do, that this was my new normal, that I had exhausted all of my options, and this was as good as it's going to get. They said slowly over the next few years I might gain a little bit more range of motion, but that was pretty much going to be it. So I said that's not going to work for me. So there's no way. I'm only 41. If I'm like this, I mean, when I sat down to go to the bathroom, I couldn't even bend my knee enough I had to stick, my leg would just stick out because I couldn't bend my knee enough to bring my foot back, to sit normal. And so I thought, if I'm already this stiff and stuck, what am I going to be like in 10 years or 20 years? So I started getting into the looking for options, and that's when I stumbled onto the fascia scene. So, oops, I went the wrong way. Fascia is, you might be wondering what the heck it is, and some people pronounce it fascia, whatever, however you want to say it. It's also referred to as connective tissue. So a lot of us have heard of tendons or ligaments, right? And these are really stiff forms of fascia or connective tissue that hold our bones to our bones or our muscles to our bones. All right. But there's over 20 different kinds of fascia in the body. And it's everything from this very thick, stiff, tendon-like tissue to very slippery, slidey. It looks like one of the forms around your organs. It looks like a wet spider web. Or also that type of fascia is right under your skin. And you can imagine you need that kind because, if I push in on your stomach, your stomach organ or your other organs need to slide and then come back, right? So think of it as layers and layers and layers of all these different types of fascia that form this sort of fabric of tissue that holds your whole body together. If you didn't have fascia, you would be a pile of muscle, bones, and organs laying on the floor. Just take that in for a second. It's the most abundant material in your body. It's made of collagen, and it's kind of becoming its own system. But also it is part of our other systems, right? It's part of our nervous system. In fact, some people refer to it as our peripheral nervous system because all your nerve endings live in your fascia. And it's your fascia with all these nerve endings kind of serves as like GPS signals coming from your body to your brain. And it's constantly 80% of the signals in your nervous system are coming from the nerve endings in your fascia to your brain. Only about 20% of those signals are coming from your brain down to your body. And so we're talking about you're feeling heat, vibration, the touch of the fabric of your couch or your chair that you're sitting on, the warmth of the sun coming in from the window, the feel of the breeze touching your skin. You have constant signals, all of that traveling through your fascia up to your brain, telling your brain what's going on all over your body and inside your body. Okay. Your blood vessels all live, so it's part of your circulatory system. All your blood vessels live in your fascia, right? Your lymph system is the waste system of the body. It's getting rid of all the junk that's, leftovers and dead cells and waste products of the body that lives in your fascia. So awesome, right? Like if that's all there was to it, fantastic. That sounds really great. But the problems arise when we have issues with our fascia, right? And so, how do we get issues with our fascia? Well, it comes from the aging process in general. Hormonal changes can affect your fascia, injuries affect your fascia, and any kind of repetitive activities. So, and it's good or bad activities, right? So, sitting at your desk, hunched over with your head forward, and you're working on your computer, you can get damage to the fascia of your arms and results in carpal tunnel issues. You can get, old injuries like rolled ankles or surgery, scar tissue lives in your fascia. Scar tissue is fascia that has locked down around an injury or a surgical site, right? And so, also any kind of repetitive motion or repetitive stillness. So sitting really still, it's going to stiffen and dehydrate and lock down your fascia over time. But also any repetitive movements, like a lot of fitness folks, they will have a stiffness from the repetitive fitness stuff that they do over and over again. So stiffness in their forearms or damage in their forearms from their weightlifting or from aerial gymnastics or from whatever activities they might be doing. Um, Fitness things like runners will get, or tennis players, they'll get fascial damage to, or, problems with the fascia around their elbows, and that results in tendonitis. Plantar fasciitis, it's an inflammation of the fascia. It's tightness in the fascia that's causing pain in the feet, right? And so, our fascia gets impacted by our daily activities, our movement patterns, our holding patterns. If you're hunching your shoulders all the time, that fascia will kind of grip and hold and lock down your tissues, and result in you kind of getting stuck in that holding pattern. So I want you to imagine maybe an elderly person like a grandparent, or I'm sure we've all seen them, but people that kind of, an older person that has hunched forward and now they're just kind of stuck like that. They can't really stand up straight anymore, even if they want to, because they started in that collapsing posture, that forward posture, and then their fascia has to shift and grip and hold over time, and it's trying to protect them and hold them and support them in that hunched pattern, but then it will stiffen and hold you in that pattern, right? So how do you know if you have fascial issues? Let me make sure I'm staying on track with my slide here. We'll get to that in a second. Um, the fascia is telling you things. You can listen to your body. A lot of what we think of as I'm getting old, how many of us have heard I'm getting old? How many of you have said, oh, I'm getting old, right? I can't see most of your faces, but I'm willing to bet some of you might be nodding or smiling at me right now. So what we think of as getting old is actually your fascia talking to you. So I like to tell people you're not getting old. Age is a thing, don't get me wrong, but a lot of what we think of as getting old is not normal. It's common, but it's not normal. It's your fascia talking to you. You've got restrictions happening. We want to free up those tissues, get that fascia moving better, hydrate that fascia, and you will feel better. You'll move better, right? It's fascia work to me, I think, is like the fountain of youth. I really do. So the other part that's really important here, so we're just talking general living here so far, but the real secret, the real important part is for those of us living with pain. And that's really what we're kind of focused on tonight, is that how is fascia tied into pain, and why? Why is fascia the missing piece of the pain puzzle? So when we get hurt, what do we do? What's the standard American protocol for I twisted my shoulder, I rolled my ankle, I bent over to pick up a piece of paper and something snapped in my back, and, you know, fill in the blank. What do we do when we got pain going on? Most of us will go to a chiropractor, right? A lot of us will do that. What are chiropractors focusing on? They're focusing on your joints, right? So they're going to realize, oh, well, you've got misalignments in your joints. We're going to pop those joints back into place and get you on your way, right? We're going to go to doctors. What are doctors going to do? They're going to give us pills to try to, again, relax muscles, right? They're going to give us pain pills to numb out the pain signals. They're going to inject us with things, trying to take away the inflammation that's coming up because we have issues going on, right? They might offer us surgeries where they're going to go in and forcibly change a situation to try to make it better. Is anybody else feeling a little depressed right now as I go through this list? It's not very helpful so far, is it? We might go to a massage therapist, which is what I do, right? And we're going to get our muscles massaged. But what are we talking about here? So far, we're talking about joints and muscles, joints and muscles, joints and muscles, joints and muscles. And the problem here is that we're not really getting to the root of the problem. So when fascia locks down, it doesn't stay in that one area. If you rolled your ankle 7 times in high school and now you've got this stiff ankle, right? It doesn't just stay in your ankle. There are 7 tensional lines in the fascia, and they've mapped this out, okay? And we're not really worried so much about muscles. Muscles will follow whatever the fascia tells it to do. So if your fascia is tugging and pulling, if it's locked down and tight, it will pull through those tensional lines and tug and pull on other areas of your body. And where we have pain is not usually where the problem is. So when we go to a massage therapist and say, my back's hurting, and the massage therapist rubs your back, or we go to a chiropractor and say, my neck's hurting, and the chiropractor says, oh, yeah, your neck is out. And then they put it back. They're not addressing the tensional lines. They're not addressing where in the body is there something going on that's tugging and pulling on this area and causing us pain. Does this make sense? I think once people get it, it's like, of course that makes sense, right? And so it's the real reason why pain keeps coming back. We go to chiropractors, we get massaged, we get our joints aligned, we do these things, we feel better for a few hours, a few days, maybe a few weeks. Now, if it's a short-term acute issue, I slept weird, I got a cranky neck, I went to the chiropractor, they adjusted me, I went to massage therapist, she rubbed my neck, and now I'm fine. That's a different issue. But how do we know if we have a fascial issue? Well, we're gonna know because it doesn't a problem keeps coming back, right? You're going to the chiropractor. Some of you, how many of you have been going to the chiropractor for years for the same problem? I went for years and years thinking, oh, well, my neck's just going to be screwed up the rest of my life because I played rugby in college and I'm just always going to have neck problems. And that's not true, right? I had TMJ problems, right? Fascial issues in my face and jaw, and also I was clenching. And so once I addressed that issue, my neck problems went away completely, right? And so that's what we find is where you have pain is not usually where the problem is. That's the part of your body that's getting its butt kicked by something else and sometimes multiple things. So I'll give you some examples. There was in our instructor group for the fascial techniques that I offer at my shop, there was a person that had frozen shoulder and it was pretty severe. She'd had it for years. She had gone the traditional medical route and had surgeries and injections. She'd done physical therapy. She'd gotten massage. She'd done all that route, and she'd gotten rid of a lot of the pain, but still had serious restrictions. She could not lift her arm hardly at all. And then she found a fascia person, a rapid. I do a technique. I offer a technique called rapid, RAPID, rapid neurofascial reset. She found a rapid person. They did the fascia release work around the shoulder. She got more range of motion, but it didn't completely free up her shoulder. So what they teach us is if you address an issue directly and you don't get full release or full resolution of the issue, then we're going to investigate those tensional lines. So this therapist started working through, there are the 7 lines for her. It was the spiral line coming down. There's a connecting line that starts on the sides of your head right here, comes down through your body, circles around your waist, comes through your pelvis, circles around your legs, and inserts into the arches of your feet. That's a tensional line. So anything along that line can cause problems anywhere along that line. So for this woman, her problem area ended up being her opposite leg, foot, ankle, and calf. She ran track in high school 40 years before this and rolled her ankle a bunch of times. That ankle was super stiff, but in her mind, that's just the way her ankle was. She didn't even put it on her intake form because it had happened so long ago. She didn't have surgeries or anything associated with it. But when that therapist followed the tensional lines, it's when she got into the foot, ankle, and calf, that's what lit that woman up. That's where all the restriction was happening. And when they freed up her foot, ankle, and calf, her shoulder released fully. So do you see why pain can keep coming back? If you just keep going and getting injections in your knee, injections in your knee, injections in your knee, and we don't find out what's tugging and pulling on your knee and causing the knee problem. And that's how we can get stuck with pain that goes on forever and ever. So if you have lingering pain and stiffness, an injury, or maybe it just built up over time, and that's a lot of people that come to me, I'll ask them, did you have an injury? Is there something that kind of set this off, or is it just built up over time? And the shoulder issues, especially, sometimes will just build up over time. But sometimes we'll have a specific issue that happened years ago, and we did the things, we did the physical therapy, we did the chiropractor, we did injections, we got a surgery, we did stuff. But whatever it was, it's not really resolved. It's still hanging out, it's still there. That's a sign of restriction going on in the fascia. And it may not be in the area that you're having problems with. There might be some issues there, but it might be somewhere else. The other thing I want you to pay attention to before you get to that place, if you have fascial issues, because let's just talk about it, it's stiffness in your body in general. How many of you, when you get up off the couch, you stand up and you're like, oh my gosh, right? Or you get out of bed in the morning and you're like hobbling around for 10, 15, 20, 30 minutes, and you got to like, if you're like the Tin Man putting oil in your joints, just trying to get yourself up and moving again. If you have that kind of stiffness going on, that's your fascia talking to you, saying, hey, we've got some issues going on here. We're getting stiff. The fascia is what we call dehydrated. And when I say dehydrated, I'm not talking about getting enough water, although that can contribute to fascial issues. A lot of times, instead of that, I want you to think about your fascia like an irrigation system or like a slow moving river. And it's got its own fluid. It's not lymph, it's not blood, and it's not really even a fluid. It's more like a gel kind of an idea. That's what I want you to think of. And it moves very slowly directly through your tissues. It's the irrigation system of the body. It delivers water, nutrients, minerals directly to your cells. So just take that in for a second. You eat your food, it breaks down in your gut, that nutrition is absorbed through your lining, it gets into your body. You drink water, you absorb that in through your belly, it gets into your body. It's your actual fascial system, the fluid that's taking that nutrition and oxygen and minerals and delivering it to the individual cells of your body. Okay? And it keeps that fascia happy and slidey, glidey, and supple. When we get hurt, the fascia gets compressed. It can get stiffened. It can lock down. There's different things that can happen. And so the fluid that is meant to flow through that tissue, it can't quite get in there. That fascial tissue is now restricted. And so when I say dehydrated, I don't mean like you're just not drinking enough water, drink more water, we'll fix it. No, we got to actually get into the tissues and free up that fascial tissue and allow that movement of natural fluid to come through the tissues again and get it back to that more supple, slidey, glidey quality or whatever that quality is that it needs to have, depending on what kind of fascia it is. Okay. So when we're looking at resolving pain fully, we want to first identify where do we have lingering pain and stiffness. We're going to look at that area directly, of course. We're not, if you have neck stiffness, we're not going to ignore your neck. Go work on other areas. Although I do see changes all the time in my fascia classes that I teach where people will work on their hips and pelvis or relax their spine and their neck releases. And they didn't do anything to their neck or they'll work on their feet and ankles and their neck will feel more free. So that kind of stuff does happen. But of course, we're going to work on the area that you're dealing with. We're also going to really look at the root cause here. So we're going to start to investigate where in the body you might have tensional issues. And so I like to start in your hands. I like to start in your feet. I'll address the area of concern that you're dealing with, and then we're going to track down where you've got stuff going on. So, and then there are things you can do at home, and don't worry, I'm going to give you some homework today. We're going to do some fascia stuff together. So stay tuned. I know I've just hit you with a lot of information and it's a lot to take in, but it's fine. Just let that be okay. You're learning, you're taking this in. It's a whole different aspect of our bodies. It's a whole different level of self-care. But once you kind of get it, you get it. And it's a lot more fun to me to work on your fascia than, like a lot of us think, oh, I'm stiff and I'm hurting. So I need to go join a gym. I need to go work out more. I need to lift weights. I need to stretch more. I hear that all the time. I need to stretch more. I need to stretch more. No amount of stretching is going to you need direct fascial work if you are feeling very stiff. Stretching alone, and I think most of you, if you're dealing with this, you do stretch, you have stretched, but stretching alone isn't going to free up your tissues. It will help. It can help in the short term, but muscles alone are not going to fix a fascial issue. And then, we want to learn what are some basic things we can do to start to free up our fascia on a day-to-day basis, and how do we take care of our fascia? And then, see how we might be able to incorporate that into our daily habits. And one of the best things I would love to share with you guys is that it's really all your body. You can do fascia work in your face. In fact, there's a lot of anti-aging stuff coming out around fascial restriction, and how we age is actually due to locking down of the fascial tissues, not just in the face, but even up in the scalp and in the ears and coming down the neck and shoulders, all of that. Forward head posture, hands and forearm issues can contribute to aging of your face. So we're going to talk about some of that stuff tonight, and we're going to do a little fascial release work around your head. Your feet and your hands are critical. So, you don't have to go join CrossFit. You don't have to, I'm not saying you don't want to work out and you don't want to strength train and do all those things. Those are important, but they're really hard to do those things when your body's hurting. How many of you feel like, I know I should be doing more. I should be doing more physical fitness. I should be doing more things. But when your body hurts and feels stiff and just walking feels like a major burden, it's pretty hard to stay active. And so freeing up one of my instructors in the block therapy, she says, if you feel like you need to get back in shape, and maybe you've been telling yourself, like, I really need to do whatever it is you think you need to do to get more fit, take 2 or 3 months and really dive into the world of fascia and get your body moving more freely, help your body find more alignment, and then go get your fitness on, right? Because then your muscles, when we're constricted and we're gripping and holding, our muscles can't even fire properly. In fact, one of the things I've learned in my fascia world is you can have deflated butt cheeks, where if you have tension in the back of the pelvis, oftentimes one side of the pelvis, of the back side of your sacrum and around your glutes, will clench to compensate for tension. But because it's clenching so hard, it will tug and pull, and it makes it real hard for your muscles on the other side of your butt cheek to be able to fire properly. And because they can't fire properly, you lose a little bit of muscle tone. So I will lay people on their bellies on the table, and you can take a picture of it. I have pictures. In fact, if you go to Haven Bodywork and Wellness on Facebook, you'll see some of my glute pictures before and afters, and it's subtle work, but you'll see one butt cheek is got a nice curve to it, and it looks, kind of lifted and good. And then this other butt cheek is just got this weird kind of sad slope, it's kind of coming down. And when you palpate and touch around there, you'll feel like this butt cheek feels like good, and this butt cheek feels just a little bit softer, and like the muscle tone's not the same. So I'll release the tension on this butt cheek over here that's happier, and this butt cheek will pop back into place and reactivate. And then I had a deflated butt cheek myself when I did the lower body training, and they worked it in class. And then when I walk, I can feel the ball of my foot. And you have to feel the ball of your foot in order for your glutes to engage properly. So if you're doing squats and lunges or just going for walks, if you go to kneel and you stand up and your legs feel real shaky, that's what my leg was doing. Sometimes it's because muscles can't fire properly. So you're shaky and weird. So now when I stand up, I can literally step down and push up, and my whole right side, it was my right glute that wasn't activating properly. I feel so connected to the ground now. So when I run upstairs, I'm confident going upstairs. Or if I'm on my knees and I stand up from the floor, I'm confident standing up from the floor. It's fixing that fascial issue helps your muscles to finally be able to properly align. And if you do have alignment issues going on, then when you go work out, if you add, especially for those of you who are lifting weights, if you have a dysfunctional system and you're adding weights to a dysfunctional system, you're driving those dysfunctional patterns deeper into your body, and you're more prone to injuries. So just addressing your whole body alignment, getting your fascia online, moving better, free, it feels great. You'll feel younger in your body, And then you can go do your fitness stuff, and all your fitness efforts are going to they're going to land. They're going to be more effective because your muscles are firing properly. You're in more natural alignment, all that good stuff. Okay. So let's see what I have here. So one of my suggestions are start with your feet. And your hands. I didn't put it on here, but feet and hands, your face, these are all great, easy places that you can start to work on your fascia because they have a ripple effect. The fascial lines from your hands come up and attach to the sides of your head, your neck, your shoulder, and the side of your rib cage. And so as you start out here in these kind of easier places, like I'm not asking you to go run 3 miles. I'm not asking you to go lift weights. I'm not asking you to go to a gym and get a membership and start doing crazy. I'm asking you to sit on your couch in the nighttime and work on your hands, play with your feet, get your toes moving. Some of the things I'm going to show you next. Get your scalp moving, check your skin. Your skin can adhere down. We're going to talk about that in a minute. So these are the simple things to get your fascia moving. And then I'll also talk about if you have specific issues like you've got some frozen shoulder issues. You've got some plantar fasciitis. You've got some tendonitis. You got a stiff neck. You can't turn your head. You're getting headaches all the time. Your back hurts all the time. I mean, the knee problems, any of these things, those are all indications that you've got some stuff going on in your fascia. I'll tell you who do you look for that can help you with this kind of stuff. So we're going to start in the feet and the hands. We're going to start to develop some daily habits to support ourselves and then start to work our way up to hydrating our spine and hydrating our pelvis. And I'm going to give you some ideas on how to do that too, that you can do tonight, or even if you don't do it on the video with me tonight, you can do it after you get off the video. Sound good? All right. I know I've been talking a lot, so let's get into it. We'll talk about supporting healthy fascia. Let me just make sure. Yeah, I'll go back here. So let me just I'm going to stop my share for a few minutes and let's just do some fascia stuff together. Okay. So, um, I'm going to pin myself here. It's just so if you guys don't mind. There we go. Okay. So I can see what I'm doing with myself. So one of the easiest things we can do is let's start with our hands. So there is the fingers can get really tight, right? And stiff. A lot of you are like, yeah, Joyce, we know. So one of the easiest things you can do to start to hydrate your hands and get those tissues opening up is you're going to take your fingers and you're just going to interlock your fingers. You guys can do this with me. So I've got my first and second finger and my first and second finger here. I'm just sliding them into each other. So you guys can do this with me. And then I like to put my elbow on my knee. And you might imagine I'm sitting on my couch right now. I could be watching a movie or watching a show. And I'm just going to push my fingers into each other. I'm working in the webbing between my fingers. Okay. So just hang out here. I want you to remember to breathe. A lot of us will hold our breath when we're doing fascia work. And some of you are laughing because you're probably noticing that you're already doing it. So just breathe. Now, when you first start out, you might do a minute. And you could have, what I do is I set my phone up and I turn on a stopwatch and I'll have a show on and I'm watching my show and I just kind of glance down at the clock and I'm watching for that 1 minute marker. And then once you hit your 1 minute, which we're not going to do too much more of that because we're not going to do all of our hands we're not going to, we don't have time to do everything tonight. But I would start with 1 minute between your fingers. And then we're going to do maybe 30 seconds just to keep it timely. And then I'm just going to switch. I'm going to slide my middle fingers, my middle and second finger. I'm going to slide those in. And then I'm going to press into each other. Now you're going to find as you work through your fingers that there's usually one or two spots that are like really tender. Like when you're working in fascia, you might notice like a burning. I call it the burning edge. That's what I call it. So when you're working in here, press into each other, keep breathing, and look for that little bit of discomfort, that little bit of burning edge. You guys finding it? Is there a little bit of like a tugging or pulling sensation here? A little bit of a slight burning sensation? And you don't have to go crazy. Diane's giving me a thumbs up. You don't have to go crazy. You're not trying to torture yourself. You're not going to do it if you're torturing yourself. Just a very slight sense of discomfort. I'm watching my show, working on my fingers, okay? If you have any kind of carpal tunnel issues, trigger finger, elbow tendonitis, numbness, tingling down the arm in any form, I want you to do finger work every day. This is a really great daily practice that you're going to build in. Okay. And then let's switch. We're going to do our pinkies between our ring and our pinky fingers. And I've got one elbow on my knee for a little bit of something to push against. And then I'm using this arm to push in. So you're going to look like a little bit of a weirdo with your family, which is totally fine. And you're going to hang out. You're going to play with your fingers and your toes because guess what we're going to do next? That's right. We're going to dive into your toes. Yeah. One of my t-shirts that I like to sell at my shop says, make friends with your feet. We're going to hang out with our feet tonight, but we're going to start with our hands. Now, as you get better and better at fascia work, you are always stimulating lymph when you work in the fascia. So if you take nice, big, full breaths, not like don't hyperventilate yourself, but just imagine you're inhaling into your rib cage, exhaling, relaxing down. Inhaling into your rib cage, exhale, relaxing down. It's going to calm your nervous system. It's going to reduce stress. It's going to help you sleep better. And it's going to help move your lymph. Your diaphragm is it's like a pump that can stimulate one of the major drainage points in your middle of your rib cage on the inside of your spine. So just by doing that, you're stimulating your dental hygienist. Yeah, Jennifer, I'm actually thinking about approaching my dentist about coming in and doing some fascial work on her because there's whole hand treatments and things you can do as a therapist to work to free that tissue up. And then last one is going to be your thumb and your first finger. I love doing this one. This one feels so good. If you are one of those people that do a lot with your hands, like I am, I love doing this one with two of my thumbs. So what do you guys think? Not too bad, right? So who's going to really want to incorporate this one? Well, everybody could benefit from it. But if if your hands are falling asleep at night, if you're waking up with tingling fingers, if you've got any kind of carpal tunnel history, even if you've had the surgeries done, do this work every day. Start to practice it, or maybe you do it a couple times a week. Instead of thinking what should I do, what I should be doing, I want you to think, how could I maybe incorporate this into my life a little bit more.
Roseanne, they're asking if you can hold your hands up so they can see it.
Oh,
There.
yes.
Thank you. Thank you so much.
Sorry. Yep. And again, if you could see my knee here, I've got my elbow on my knee and I've got my hands right into each other. And I'm pushing, this hand is pushing into my other hand to create the tension. And as you get better and better at this, guys, you'll get better. You'll be able to go a little deeper. Now, if you've been following along with me, just let your hands go. Now give them a squeeze. What does it feel? Feels nice, right? Feels a little more free. So this is a great habit. Your fingers might feel free. So next thing we're going to do is your fascia in between your joints. Your joint capsules are fascia-rich areas. And your joint capsules will help bring more fluid into your fascial system when you stimulate them. Movement of your joint capsules is medicine. So movement is medicine. We want to do your joint capsules. So we're going to take your finger and use your hands, and you're just going to grab your finger. And I like to use my thumb to stabilize. So we're going to hydrate this joint right here. This joint right here. So I'm going to grab it, not too firmly, but a little bit. I'm going to stabilize with my thumb. And all I'm going to do is gently twist the tip of my finger. So here's what it looks like from the top. See how I'm twisting it? I'm not causing any pain or discomfort here. I'm just twisting it. And we're going to create, by doing this, it's creating a little bit of fluid exchange through that joint capsule. So I'm going to do that first. Then I'm going to move my thumb down and I'm going to do this joint right here. So I'm going to hold this whole section of my finger, I'm going to hold it and I'm going to gently twist. So this is really good if you have arthritis in your fingers. Okay. Good. Everybody with me? So I'm just twisting. Now you're going to get a little movement in this part of the finger, but I'm using my thumb for a little support here. And if you can't do that even, just do the best you can. Hold your finger stiff and just twist it a little bit. Okay? And you can do that with each finger. So I'm going to twist my middle finger. I do this all the time as a massage therapist to try to protect my hands. And I'm going to do my middle finger. Now, you're not going to do it to your knuckles. But I'm just twisting it. Now, I'm not going to do all of them because that would take a lot of time, but you guys can do that. So we can work it into the webbing of our fingers. That's what we're doing here. We were doing earlier is hydrating the webbing of your fingers. And then we're hydrating the finger joints. And you want to don't forget your thumb. So if I'm going to do my thumb, I'm just going to hold my thumb like this, and I'm going to twist the tip of my thumb back and forth. Okay? So work with that and add that to your list. So twisting a little bit of your joint capsules in your fingers and freeing up your the webbing between your fingers. These are fantastic daily things. Most of you, they're not going to rock your world in one go, but they will change your hands and start to move your fascia over time as you build them in a little bit, okay? All right, so from here, we just worked our hands. Let's work into our neck and face a little bit, okay? So from here, one of the really nice releases that you can do, I'm sure a lot of you get neck tension. You feel like you're massaging your neck a lot. So what you can do, let's see if I can show you guys this easily, is you're gonna, let me think about this for a second. How am I gonna explain it? So what you're gonna do is just follow me for the first side and then watch, and then we'll do it all together on the other side, and then we'll do it again. So I'm going to place my hands on my chest, and then I'm going to tip my ear, my left ear towards my left shoulder a little bit, okay? And then once I'm tipped, I'm going to look up. So I've got the window right in front of me. I'm looking up at the sky, and then I'm going to pull down this side. I'm going to pull down on my opposite chest. And then I'm just doing micro moves with my nose, feeling for that tensional pull through my right side of my neck. So I tip to the left to work with the right side of my neck. My hands are on the right side of my chest. And I'll talk you through this in a second. And I'm just micro moving, enjoying that tensional pull. You might even, I'm feeling it up into my jaw even. And then to come out of it, I'm going to bring my face back down and then bring it straight back up. It is important to come out of it the same way you went into it. Okay. So let's do it together. So for you guys, you're going to take your hands onto the left side of your chest. Okay. And then tip your head to the right. Make sure you just go straight to the side. Don't look down. That's really important. Tip your head to the side, ear towards your shoulder. That's not touching your shoulder. And then once you're here, let your face shift upward until you feel and pull down with your hands. My hands are on my chest and they're pulling straight down. And now I'm getting this really nice tensional pull. It's not a stretch. I can kind of see like an idea of it, but I'm not stretching my muscles. I'm actually pulling through the fascial lines of the neck here. And then I'm going to tip my nose slightly, move my jaw to find that exact spot of, yes, that's the spot right there. You really lengthen right there. And then to come out of it, I'm going to bring my face back down and then lift my head. Take your time and then turn your head a little bit. How are we feeling? You should be feeling more free. And if you did well with grip into your skin and pull down, you're also going to feel a little more freedom here in your chest. How are we doing so far? Okay, so we just freed up our neck. Crunch, crunch. Pardon my little dog there. She's a little crazy. Okay, and then the next one I'm going to show you, this one's actually a muscular one, but it's also going to free your chest up and get your chest open so that you can relax your neck and shoulders a little bit. I'm going to let my dog out. 2 seconds, guys. Okay, so what you're going to do is you're going to sit up comfortably, kind of nice and tall. You're going to take your fingers, I'm going to get my necklace out of the way. Take your fingers like this, okay? And then find your sternum. That's that hard vertical bone in your chest. And you're going to push off the sternum into your pec muscle, which is your front chest right here. So you'll feel hard bone, now soft, squishy muscle, okay? And then all I'm going to do is push across that muscle. Your pec muscle goes sideways here. So I'm just following the line of the pec muscle. And you can push in pretty firmly here because that muscle is a deep muscle. There's not, the bone is pretty deep down in there, or the ribs are. So you're not gonna hit any bony surfaces. And then I'm just gonna, I started right under my collarbone. I'm gonna do multiple lines, just pushing across. And obviously we're not gonna go down into breast tissue at all. So once you get to that point where you're kind of hitting that, you're not gonna go any further. And you can do it a few times. Just coming across. Make sure you get right up under your collarbone. That'll feel really nice. There's a little muscle that goes through there that can get bunched up for some of us. It feels good. And then when you're ready, you're going to switch sides. So I'm going to take my fingers. I'm going to go to the opposite pec. I'm going to push in and go straight out. Now, how far do we go out? Well, I'm hitting my shoulder bones right here. So I'm not going to go into the bones. I'm going to stay in that pec muscle and straight across. And as you get comfortable, it's your first time doing this, you're going to be like, whatever. But as you get more comfortable doing it, you're going to be able to really sink into the tissues and take it across. You might use a little bit of lotion and just do your bare skin, and that's really going to help you get into those tissues and relax that. If you do that, you're going to notice, even just those few passes I just did, my chest is more relaxed and I'm breathing easier. You guys with me? Okay, so we talked about fingers. We talked about finger joints. We worked into releasing that fascial tension through the neck and shoulders here. And so next up, we're going to do what's called the facelift. So this stimulates the fluid in your face. Okay. It is a little bit anti-aging. It will stimulate collagen. It will help with drainage of and puffiness in your face, all that kind of stuff. And it's really easy to do. Now, there's a melt ball. The melt is Melt Method. You can look this up online. They have an app. You can order a roller or the balls and do all kinds of body fascia work. I love it. I'm an instructor with them. But you don't have to have the ball for the face treatment. That's what I really like about it, because then you guys can just do it anytime. You're traveling on an airplane, you're on a long car ride, and you're feeling gross and stiff and unpleasant. Maybe you have a photo shoot or a wedding coming up. You want to look good for your photos. You're going to do the face treatment. So what you're going to do is I like to use the base of the palm of my hand, especially this meaty pad right here or down this meaty pad. These are all good tools. And the three areas we're going to work are the bony surface behind your ear. So everybody take your finger, go behind your ear and tap, 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 tap. Feel that bony surface back there? That's the first spot we're going to do. And it's kind of rounded. You'll feel it's kind of rounded. Okay, that's the number one spot. The second spot, you see my little ear nub right here? Everybody got an ear nub? You're just going to come out from your ear nub about an inch, and you're going to feel, this is my cheekbone right here. I'm right under my cheekbone. And if I open and close my mouth, I can feel my joint is right there. There is a ton of fascia and muscle right here. So we're going to be working right here under the cheekbone, directly out from your little ear nub. Everybody got it? That's our number two spot. Okay. Number three is this divot on the side of your eye. Divot on the side of your eye. Okay. So you decide what feels best for you. I'm going to work with this meaty part of my hand. I'm going to take it up and try to find something you can rest your elbow on. It works best if you can rest your elbow. If you can't, then you can just sit upright and do it. But then you have to work harder. And who wants to work harder, right? So I'm going to put my elbow on the couch right here. I've got that rounded part of my skull behind my ear resting into that meaty part of my thumb, right? My thumb pad under here on my wrist, okay? Now all you do is let your head relax, and I want you to make small circles. Stay gripped into the tissue. So you're actually sliding the tissue along the surface of your skull. Do you guys feel this? You're gripped in and you're moving the tissue over this area, sliding it across that bony surface. My breath is deeper, easier, and having tension really stay on. This is also great for nervous system work, guys. So if you have anxiety, if you struggle with PTSD issues, if you have chronic stress, see, I just had a nice big sigh. This will calm your nervous system. I'm gonna make you guys all sleepy. You can just go to bed after this, okay? So you're in charge here. You can take nice gradual time. If you've got a sinus headache or a tension headache, if your sinuses are plugged up, if you're clenching your jaw a lot, if you're just feeling pretty crappy, you can do this for 30 seconds or even a minute. But if you're in a little bit of a hurry, this is a good amount of time. I'm going to pause and wait. Just let your head relax into your hand. Take a breath if you haven't already. Good. And now let's move. I'm working with this part. You could be using over here too, or wherever in the hand feels good. I'm going to see how I'm nesting that right under my cheekbone. And then I'm letting my hands relax again against the side of my head. And then tip your head. Now, if you have TMJ issues, this might be very tender. So if you're one of those people, I want you to keep your head a little more vertical, because the more you tip your head, the more weight is going to go into the tissues. So go easy. We're not trying to cause pain here. So I'm just working. See, I'm trying to open up a little bit. You don't have to do this. I'm just showing you. See, I'm using this part right here, and I'm right up under that cheekbone. Now, your masseter's right here. So if you're a clencher, if you clench your teeth, if you grind your teeth at night, again, this may be very sore. So you could do this every day, even morning and night, to help relax these tissues. I'm going to show you one more trick after this to help with TMJ issues too. Now pause and wait and just relax. Let your head relax into your hand. Take your breath. And then again, I'm going to take this meaty part, I'm going to put it into that divot. There's a low spot. And again, if you put your finger there, open and close your mouth, you're going to feel this is part of your jaw tension up here. So I'm going to put my hand in there, that part of my hand. I could do this part too. Some of you will like this part better. That's okay. Just use whatever part of your hand makes the most sense. I'm just going to make circles here, staying gripped into the tissues. I'm not sliding my hand over the skin. I'm gripped into the side of my skull and then making the circles. And then pause and wait. Oh, this is tender for me. And then come back down to your cheek. We're going to do one more spot here. And you might go the opposite direction this time and see how that feels. Linda asks if it matters if we do clockwise or counterclockwise. No, it doesn't. You're going to do this spot and this spot twice. You do this one, this one, this one, come back down to this one and back to this one again. So when you come back to these two, you might do the opposite direction, but you don't need to keep track. Just kind of try to go. Now pause and wait. And then move back behind your ear and try experimenting. Use that other spot of your hand. You might try this spot if you've been using this one, or this spot if you've been using this one. Go the opposite direction. And you can make this pretty juicy, guys. You can really relax your head into your hand and really try to. It works better if you tip your head into your hand if you can tolerate it, because if you're doing this, you're probably making your neck muscles work, and that can actually cause tension. And we don't want to do that. So we want to try to keep the neck and everything as relaxed as we can. And then let's pause and wait and relax for a second. And then we're going to sit up. And just notice, what are you feeling on that side of your face? I feel more relaxed. I get a little buzzy humming sensation over here. That's a fluid exchange that's often happening. And sometimes people do before and after pictures after a full melt treatment, and they can see more plumpness, their eyes feel more open, stuff like that, less tension. I'm less concerned about the beauty aspects and more concerned about the tension and pain relief aspects, but you do you. And sometimes we do want anti-aging. So you could look for that kind of benefit as well. What about bone on bone knee? We're going to talk about that, Barb. You hang around, okay? Let's do the other side. We're going to put the hand behind our head. Actually, for the interest of time, I'm going to let you guys do the other side. Just do it as you go here. But I'm going to keep moving forward because I just don't want to run out of time. Okay, so we did that. Now, if you have specifically TMJ issues, here's how you're going to add an extra thing in. This is not part of the melt face treatment, but it's a nice add-on. You make a little finger, like a hook, you know that game, what's that game you pay pen and paper, hangman or something like that? Whatever it is. Make a little hook like this, and then you're gonna take it and nest it right up under your cheekbone and put your thumb on your jaw for a little bit of support. You're just gonna press in and let your mouth hang open a little bit. So I'm gonna do this quietly for a second so you can do it without me talking. So I'm gonna relax, let my mouth hang open. And I'm just pulling straight down, pressing in. I'm pressing in, not crazy agonizing torture here, just press in firmly and drag down. This is to relax those muscles on the masseter comes down right here and attaches to here. And we're relaxing that down. Okay. And then if you have fascial issues, if you specifically have TMJ issues or tinnitus issues, I'm going to take your finger. This is a weird one, so you can do it on your own time if you don't feel comfortable doing it here. I want you to take it. I'm going to tell you first, and then I'll show you. You're going to be putting it in your mouth as far up into that nook between your gum and your cheek, the inside of your cheek. And there's a nook up in here. There's a muscle on the inside of your jaw that goes from it mirrors the masseter. It goes from here to here, but on the inside of your face bones and your jaw. Okay, it's called your pterygoid. So it looks like this. I'm going to take my finger. I'm going to slide it all the way out as far up in there as I can. And now all I got to do is turn my finger. It's uncomfortable, especially if you have TMJ. And I do. I have. So you're getting as far up into that nook as you can. Stay along the side of the gum line and the teeth as far up into that nook as you can, and then you're just turning your finger. And it is going to have, oh, good. Yay. Lilith says she's having some relief from her headache. I love that. And then you're going to do that on the other side. So release your masseter, then stick your finger up there, rotate, and release your pterygoid, and that's going to relax your whole face. Okay? I already feel a difference here. We're going to keep moving forward. So hands, we're working the webbing, we're working the joint capsules. Face, we're releasing the tension on the side by doing the side and then looking up and pulling down to create tension align there. Then we can do the melt method face treatment coming back down, right? And you do it on both sides. That's great for sinus headaches, anytime your sinuses feel plugged up. If you have headaches in general, TMJ issues, you want to look better for a photo shoot or a wedding or something like that, these are all good reasons. If your face is very puffy, these are all reasons to do the face melt method. And also neck and shoulder pain, it will help release neck and shoulder pain. Okay. And then the last thing I want to do with your face is just take your fingertips and put them along your hairline. Press in, push your fingertips into your skull. And now push back. Don't let your head come back. Just push back. And now stay gripped into the tissues and kind of shake it a little bit. And now I'm going to let my fingers kind of move back a little bit. I'm slowly working into my hairline here. And I'm kind of shaking. See how I'm doing that? And then I'm going to reposition, come up a little higher. I'm going to grip in. I'm going to push. And then I'm going to do a little shake here. This is really good for those forehead lines, tension headaches, forehead wrinkles, if you get those 11 lines, which I do. And you can start anywhere. Grip in here. Work through the tissues here. Give it a shake, and we're pushing back, pushing back. Rebecca, I'll answer the questions at the end, Rebecca. So work your way through. And then you can do that as much as you want. Great for headaches. But a lot of you, I want you to pay attention to the movement of your skin over your skull. You can test it. Like this way, I'm getting good movement, right? Side to side, I don't have as much movement. So your skin can actually glue down. This happens all over your body, can glue down onto your bony structures. And that's part of aging as well. So you can just grip your fingers in and move your skin over the surface of your skull. Press down. I'm pressing down to the bone and sliding. I'm not causing agonizing pain now, but some of you will find pain in your head when you do this work. Okay. So, are you going to do this for an hour? No. You're going to do 5 minutes of scalp work while you're watching TV or in the mornings after you wash your face and things like that. Okay. And just find those times that you're kind of gripping in, you're checking out your movement. This will help your hair grow better because when your scalp is glued down, your hair has a hard time growing. And you're just working through those tissues. And you can always grip and hold. And we're going to talk about grip and hold in your legs next. But you can press in and just pull back and hold. Grip and hold. And it will release tension. Grip and hold. It really does feel amazing, Peggy. Okay. So those are your face things that I want you to play with. And you guys will have this recording that I would make a little checklist to remind yourself of what your options are. And then you'll have the video because I don't think she leaves videos up forever. But the last thing we're going to talk about are your feet. Now, I want to tell you that I am moving right now. I'm moving my shop to my house and I'm in the middle of a crazy remodeling project. And I've been working my butt off for weeks. So my feet, I walk barefoot a lot and my feet are a little dirty. Okay. So no judgment. Just a judgment-free zone. All right. So what we're going to do, we're going to get into our feet. So if you can't get to your feet, I'll give you an option at the end. And we're almost done here. Sandy, hopefully you don't mind a couple more minutes. But what you're going to do is get your foot out if you can. So I got my foot here. We're going to make friends with our feet tonight. Okay. So what we're going to do is very similar to the work that we're doing with our fingers. So you've got my toes here, right? My feet are actually not that bad. I'm pretty proud of myself. I'm going to take my fingers, and all I want you to do is start to slide your fingers between your toes. Now, some of you are not feet people, and you're not going to love this part. So if you need to go to the bathroom and take a 5-minute break, you're welcome to do that. Now, sometimes it helps if you turn your fingers sideways. Because your fingers aren't as wide sideways as they are the other way. So I'll actually slide them in sideways. Okay. And then I'll rotate them. And they don't have to go all the way down. You might just start at the tips. So see how I'm getting my fingertips in between each of my toes? And then if you can work them down, do it. If you need to keep them out in the tips, that's okay. I do toe work quite a bit. So I can actually get my hand to my bottom of my foot and hold hands with my feet. I know this is weird. Alice, I will give you specific recommendations on that soon. She's asking about finding a fascia massage therapist. So toe work is a lot like now, how many of you have heard of those toe spacers? Have you guys seen those little gel toe spacers that you put between your toes? So while we're holding hands with our feet, if you want to join me, I'm holding hands with my feet because we love our feet. Our feet are amazing. I don't care what your feet look like. I don't care. So many people are so mean to their feet. They think their feet are so ugly, yada, yada, yada. Your feet are amazing. Say nice things to your feet. They can hear you. And they do so much for us. And they keep us mobile. So be nice to them. We're going to try to work with our toes, get any kind of space in here. And if you really can't get all your fingers in, start with one. Just do one. And then all we're trying to do is pull down into that webbing, if you can, and start to create space between our toes. Modern day shoes are very stiff and they cram your toes together and pull your toes out of their natural alignment. Your toes are meant to participate in every step that you take. They have a job to do. And modern shoes stop them from being able to do their job. So then they just go to sleep. They get crammed together and they can't function anymore. And because they're crammed together, those muscles they can't fire. Just like any other part of your body. If your body's out of alignment, your glutes can't fire properly. Your quads are overworking, they can't fire properly. Same thing happens with these tiny little muscles in your toes. Okay? And then the ripple effect, though, goes all the way up your body. If your toes are asleep and they're crammed together and they're not functioning, it will cause ripple effects all the way up your body. Okay? With every step that you take. So we're just creating space. So you start out maybe 30 seconds or a minute, however long you can stand it. And then if you want to go the extra mile, you can squeeze your fingers with your toes and squeeze your toes with your fingers. So it's like we're holding on for dear life. It's like if you were in a shopping mall with your 4-year-old and you're afraid they're going to pull their hand away and run off. We're holding on for dear life. That's what we're doing with our toes, right? We're squeezing. And now I'm going to release. And now look at the space between my toes. That's a natural spacing. That's what your toes are meant to do. And instead, they're often all crammed together. So we're going to do that on both sides. The toe spacers that you can buy, the little gel ones, those are passive toe spacing. You're putting them in there. You're only going to keep them in there for maybe 5, 10, 15 minutes. Don't wear them under your socks. Don't wear them in your shoes. Okay. That puts a lot of pressure and cause circulation problems. You want to wear those when you're getting ready to do a yoga class. If you are walking around the house cleaning and sweeping and vacuuming and doing your dishes, throw your toe spacers on. It gets your toes into natural alignment as you're walking around your house barefoot, and it lets your toes start to participate in your steps while you're going about other activities. Okay. You can also put them on before bed, and I promise you, you will rip those suckers off about 15, 20, 30 minutes into sleeping, and you'll find them on the floor and shot all over the room because your sleepy self is going to be like, what the heck is on my feet, right? That's passive toe work. What I'm teaching you is active toe work. We are actively engaging the foot structures to space the toes out. This is going to be far more effective and faster results than those little toe spacers will ever do. Love the toe spacers, but those toe spacers alone are not going to fix your alignment issues. So I'm just squeezing my toes on my opposite foot, and my toes are squeezing my fingers. Yes, it does, Catherine. We're going to talk about that. Love my foot. Love it. All right, good. And now I'm going to pull it out and look at all that beautiful space. Now, it's not going to hold long term, especially in the beginning, but slowly over time, you will make more and more space and get your feet in more natural alignment. And loosening up the fascia between the toes, it's going to bring more blood flow to your feet. If you're in your more senior years, blood flow to your feet is a critical aspect of your health. Okay. So this is not just random, not, oh, it's nice if you work on your toes. No, it's a critical part of your mobility and the health of your whole body. Okay. So we're going to get your toes moving. Okay. And then let me think if there's anything else I want to show you. I think that's really good place to start. I've given you plenty to work with here as far as getting your toes working, your fingers working, working around your head, neck, and jaw. And so let's get into some of the questions that you guys have had and how can you go further than this? Well, the two techniques that I really love and I teach are the melt method and block therapy. So you can look them up online. They have apps. Melt Method has an app that you have pre-recorded little classes and things. The block therapy people have a membership with tons of pre-recorded videos that you can get into. And I love block therapy. They give you a lot of guided support, and they have like 30-day challenges and all kinds of cool stuff. Melt Method is more gentle. It's more relaxed. It's more about fluid flow and alignment. Block therapy is deeper tissue work. So they're really going after those restrictions. Oh, sorry. My dog just barked. So block therapy can be great if you're okay with a little more discomfort. So if you've got stiff shoulder and you want to get in there and fix that shoulder, I would steer you more towards block therapy. Okay. If you want to work with a specialist, because that is helpful, you can Melt Method, MELT, all capital letters, and method is the second part of it. It's meltmethod.com or blocktherapy.com. Those are my two faves. And then I'm going to post a link to a email list if you guys are interested. I am getting classes and things going on Zoom. I just moved my shop and it's a little hectic, but by the end of the summer, I will have online sessions that you can join if you want to jump in on them. If you want to be notified on those kind of things, you can jump on this email list and I'll post the link. I'm going to post it right now just so I don't forget to do that. And then, well, okay, I got to go copy it again. It stopped it. But Sandy, help me remember to give that to you and you can share it with everybody. If you want to work with a therapist, I love rapid neurofascial reset. That's what I'm getting trained in. I'll be a pain specialist and I'm going specifically after pain and restriction. That's my job. So you can look there's not a lot in the US though. So it kind of depends on where you live. And I know we've got people from all over the place. If you're in Canada, high five people because the people that developed this technique live in Canada and they have trained a lot of Canadian therapists. So you can find a rapid specialist there. You can go to rapid, RAPID, NFR.com, rapidnfr.com, and look for it, use their map system, find a specialist, and they have you can find somebody that can help you there. Okay. But also, if you don't have someone near you, if you're more in the US and you don't see a rapid person, look for someone who does rolfing, ROLFING. I will warn you that is very deep work and it can be very painful and uncomfortable, but it can have amazing results. So just be prepared for that. Or you can look for a massage therapist who's trained in structural integration. And I'm going to give Sandy my PowerPoint slides, and these names are all on there so you guys can look at this and have a list. But structural integration, uh, fascia release work, things like that, those are all indications that someone's trained in actual fascia work. Okay. All right. I'm going to go back through the questions here
I'm going to
quickly.
wrap up while you look at questions.
Okay, great. Sounds good.
Okay, so please join the Discovery Central Facebook group so that you can no upcoming classes. All of the July are out there. There's 5 Wednesdays in July, so it'll be packed tight. And then, how do I get this recording, Sandy? It's either on the Facebook group, which you have to join, it's a private one, or join the email list and they will send it to you, or it's also on my Facebook as well. So keep that in mind. And then many of you, again, are going to graduate tonight. So go to the bit.ly/grad progress 2026. Check where you're at. If you're number 10, then either way, you want to come over here. But if you're 10, hold on and I'm going to tell you what to do. But if not, either way, if you're on even for the first time, go to the bit.ly/continuing ed 2026 and then write down register that you attended. We cannot go back. We're all adults, so we want to make sure that you follow up with what you have to do, which is real simple. And Kelly will put that in the chat. There it is. She's got it right there. And we have a number of great education classes on our permanent library. So please look at that, bit.ly/permanent library, DE for Discovery Essentials. It is case sensitive. And so if tonight is class number 10, you can either select the essential oil certification. If you've already done it, you can gift it to anybody or pick any one of these two. So take a picture of this if you want, because you need to select any of these two if you're going to graduate tonight. And I'll just wait just a second. So go ahead and select that. And this is open to anybody. You do not need to be part of our team and Betty's team or anybody. This is open. We open this up to everyone. There are 3 types of people that join doTERRA. Those that want to live, share, or build. And definitely reach out if you have wanted any of that. Retail, wholesale, or below. I want everyone to purchase below. And how do I get below wholesale? I am constantly, and you hear those of that are on each week, I am constantly looking at the kits. I purchase a kit probably once a month, guys. I've been looking back now and I am constantly purchasing. I gift some of them like tonight. I'm always paying it forward, having drawings in the booths, whatever it might be. So either scan the code or bit.ly/enrollment kits US. And if you're looking at starting tonight, don't forget to reach out if you do not have a Master Club code, because you can get some free products there as well, as we talked about. And you can pick one of these if you're placing 150 PV. Please call me, text me, or email me. My contact information is there. I am looking to book my end of November and in December classes. And yes, guys, I know you're going to reach out and say, Sandy, can you get Joyce and Day back? Yes, I will reach out to her, maybe even following this, and we will get her back because I know I'm going to have requests. So I'm going to stop sharing. I'm going to ask her to please pick